Have you ever wondered how well our workers' compensation system supports those struggling with work-related mental health conditions? Imagine this. John, a dedicated employee for over 2 decades, finds himself grappling with severe anxiety and depression due to an increasingly hostile work environment. His productivity dips, his relationships suffer, and the joy he once found in his work evaporates. Desperate for help, he turns to his employer's workers' compensation system, expecting it to provide him with the support he needs to recover. But instead of aid, he encounters a labyrinth of complex procedures, dismissive attitudes, and a system that seems designed to deny rather than provide help. His claim is rejected on the grounds that it's challenging to prove the direct link between his work environment and his mental health condition, a common hurdle in mental health claims. John's story is not unique. Across the nation, countless workers face similar struggles, their mental health deteriorating due to work-related stress, and their pleas for help ignored by an outdated and inefficient system. Our current workers' compensation system is woefully inadequate when it comes to addressing mental health issues. It often fails to recognize the gravity of mental health conditions, treating them as less legitimate than physical injuries. It also lacks uniformity, with standards varying wildly from state to state, leaving some workers with robust support and others with virtually none. There's a pressing need for federal standards in workers' compensation, especially concerning mental health. Such standards would ensure that all workers, regardless of their state or industry, receive the support they need. They would also foster a more compassionate understanding of mental health issues, recognizing them as legitimate work-related conditions that deserve attention and care. But this isn't just about workers' compensation. This is about the broader context of mental health care in America. The plight of workers like John underscores the urgent need for comprehensive federal guidelines that address mental health in all aspects of life, not just in the workplace. In summary, the current state of mental health support within the workers' compensation system is inadequate, leaving many workers unsupported and suffering. The implementation of federal standards would ensure uniform and effective mental health support for all workers. Moreover, a broader application of these guidelines in various scenarios would contribute significantly to improving mental health care in America. The time for change is now, for the Johns out there, for every worker struggling in silence, and for the well-being of our society. It's time to acknowledge, understand, and address mental health with the seriousness it deserves, because mental health matters in and out of the workplace.